Hi, welcome to the NEET PG Core Revision Series in Pharmacology, where I will be taking you through the important topics in pharmacology for the upcoming NEET PG examination. So, we are going today to do anti-epileptic drugs. So, first, a question from the previous year. Which of the following drugs acts on sodium channels and enhances slow sodium inactivation? Phenytoin, lamotrigine, lacosamide, topiramate. So this question is to tell you that they can ask you about the various mechanisms of anti-epileptic drugs. So you need to be very thorough with that. Okay. So here the correct answer is lacosamide. So we are now going to do all the important mechanisms and whatever important things about each of the anti-epileptic that you must know. So moving on to these anti-epileptic drugs, the first drug is phenytoin or hydantoin. If the chemical name is hydantoin. Now, what does this drug do? It prolongs the fast sodium inactivation, not the slow, but the fast sodium inactivation. So, the rapidly firing neurons, the sodium channels in those neurons are affected. Other important things to know about this drug is that it follows zero order kinetics. Okay, so it follows zero order kinetics. Important uses of phenytoin, it is used as one of the first line drugs in generalized tonic-clonic seizures. It is also used in focal seizures. Remember, now we don't call partial, we call it focal seizures. Then it is used in digitalis induced arrhythmias. But remember that this drug is contraindicated in case of absent seizures and in case of myoclonic seizures. Okay. Moving on to the various adverse effects of this drug, very important. So remember a mnemonic here. We have hydantoin. So H stands for hypersensitivity reactions and H stands also for hemorrhage. Hemorrhage in newborns. So therefore you need to give vitamin K injection. So there's a risk of hemorrhage in the newborns. I stands for increase in the vitamin D metabolism. Because of this, there can be osteomalacia or there is interference in folic acid metabolism or absorption rather, folic acid absorption, and the patient can have megaloblastic anemia. G stands for gum hypertrophy or gum hyperplasia. H, hirsutism, and another H stands for hyperglycemia. Hydantoin stands for fetal hydantoin syndrome. The hallmark is here cleft palate or cleft lip. So these are the important points about phenytoin. Moving on to the next drug is valproate. Now valproate is a broad spectrum anti-epileptic. What do we mean by that? It inhibits number 1, the sodium channels, number 2, the calcium channels, the T-type calcium channels, also inhibits the enzyme GABA transaminase. Now GABA transaminase is involved in the metabolism of GABA. So therefore, it will inhibit the metabolism of GABA and increase the GABA levels. Okay. Now this drug important thing, most of the anti-epileptic drugs are enzyme inducers, but this is an exception to the rule. This is an enzyme inhibitor. Then valproate is a drug of choice for various conditions. For example, in generalized tonic-clonic seizures, in myoclonic seizures, atonic seizures, absence seizures, and Lennox-Gastaut syndrome. It's a mixture of many seizures. It's a resistant type of epilepsy, right? So these are the important uses of valproate. Now, what are the important adverse effects of valproate? Very, very important as well. So remember another mnemonic here. Simply you have to remember valproate. V stands for vomiting. So it can cause vomiting as well as nausea. A stands for alopecia. L stands for liver toxicity. It's a hepatotoxic drug. That's why it is not recommended for children less than 2 years of age. P stands for in pregnancy. It is contraindicated because it is one of the most teratogenic drugs. So what it leads to? It can lead to neural tube defects and spina bifida. R stands for rashes. O stands for obesity. So there is increase in weight which is seen with this particular drug. I stands for increase in the tremors. And C stands for curling of hair. Now remember, all these adverse effects, they are seen in therapeutic doses, right? When you give them in therapeutic doses over a prolonged period of time, these are the adverse effects seen. What will you see in case of overdose? So if patient takes multiple tablets together, so there is risk of overdose. So overdose toxicity, it will look like patient will have ataxia. Patient can have diplopia and patient can have nystagmus. So these are seen because of overdose toxicity. Now, valproate toxicity, if it is associated with hepatotoxicity and hyperammonia. So if there is hyperammonia condition, then the treatment or the antidote is L-carnitine. Now, in some cases, if there is no increase in the ammonia levels, but if the patient has CNS depression, though it is not the antidote, but the drug naloxone has been found to be effective. It's a non-opioid mechanism by which it works, but it can bring down the central nervous system depression in these patients. So if it is hyperammonia, then your drug of choice antidote remains L-carnitine. But if there is no hyperammonia, then L-carnitine is of no use there, right? So what you do there is basically you give for CNS depression, the trial of drug naloxone was given and it was seen that patients can benefit from giving this particular drug. Okay. Moving on to the next drug, it is lacosamide, the one in the question. So it enhances the slow sodium inactivation. So always see the question. It is the slow sodium inactivation. They would have mentioned this, right? So what does it do? Slow sodium inactivation. So it will stabilize the neuron which are in the depolarized phase, right? That they are going to do. So they have less effect on the normal neurons, right? So what to do here? Example or one important thing that we have to take care of, the same sodium channels are present in the heart as well. So because they block these sodium channels in heart, so they can decrease the AV conduction, right? So patient has a risk of developing AV block. So we have to be careful in cardiac patients. Topiramate, another broad spectrum drug, and this topiramate, it blocks the voltage gated sodium channels. It will enhance the GABA A channel, so GABA A activity, and it will block the AMPA receptors as well. So what are the adverse effects seen with topiramate? Adverse effects, it will cause weight loss, it can cause renal stones, and it can cause metabolic acidosis. Now, what are the uses of topiramate? Because it causes weight loss, this drug has been approved for treatment of obesity. It has some other uses as well apart from being an anti. So these are the other uses apart from being an anti-epileptic drug. It is also used for migraine prophylaxis. It is used for reducing the alcohol craving. It is also used in bipolar disorder. Next drug we have is zonisamide. It blocks the fast sodium channels and also the T type of calcium channel. So this drug will be effective even in case of absence seizures, right? So the major adverse effect where you need to know about this drug is that it can cause renal stones, just like topiramate, because it's also it's similar in that has a sulfonamide derivative also, so hypersensitive reactions can also be seen with this particular drug. Then carbamazepine. Now carbamazepine prolongs the fast sodium inactivation, and important thing here you should know that this drug has a property of autoinduction. It will induce its own metabolism. So gradually you will have to go on increasing the dose of this particular drug. Now this carbamazepine is a drug of choice in focal seizures. It can be used in trigeminal, rather drug of choice in trigeminal neuralgia, and it is also used in diabetes insipidus. Okay, so what are the adverse effects with carbamazepine? So remember a mnemonic dash, D A S H. So D, diplopia and ataxia. A, it can cause agranulocytosis. Okay, and as I told you, another thing you can remember, it's an auto-inducer. S stands for SIADH. It can cause SIA, syndrome of inappropriate ADH secretion, because it enhances the ADH secretion or release. Because of this, it can land a patient into a condition called as dilutional hyponatremia, and this is more often or more common in case of elderly patients. So one has to be very careful while giving carbamazepine to an elderly patient. All right, then H stands for, it also is hepatotoxic and can cause hypersensitivity reactions. Okay, so that is carbamazepine. Now, another the newer congener or modified congener of carbamazepine is oxcarbazepine. Now, everything is similar to carbamazepine. The difference is, what is the advantage of this? Number one, it has decreased chances of induction. So, it is a less potent inducer, but it has increased tendency to cause hyponatremia. So the other side effects are comparatively less. Exception is that it has an increased tendency even than carbamazepine to cause hyponatremia. Then we have lamotrigine. Now lamotrigine blocks again the fast sodium channels. It is a drug of choice for focal seizures, especially in the elderly, because in elderly carbamazepine we are scared to give because of the dilution hyponatremia. So we can prefer lamotrigine instead in cases of elderly. Now this drug is one of the drug which is safe in pregnancy. You can give it in pregnancy. Major side effect with this is the kind of rash it develops. So rash can be from mild and it can be increased in intensity to Stevens-Johnson syndrome or toxic epidermal necrolysis. So always start with a lower dose and then you gradually escalate. Otherwise, if the patient, you give a high dose, the patient can land into severe rash. Then we have retigabine or ezogabine. So it's the same name. So in US it is called or in the European, that is the difference. In Europe and in US the names are different. The same drug is same. So either retigabine or ezogabine. It's a potassium channel opener. So potassium channel opener it is used, and this is drug which is meant for focal seizures. For focal seizures. The adverse effects, it can cause urinary retention, it causes blue-green skin pigmentation, and it can cause retinal toxicity. So R for reticabine, R for retina. Okay, so we can, at least this side effect you should know. Next is felbamate, which is an NMDA receptor. NMDA is the receptor for glutamate. So it is a glutamate antagonist. We know that in epilepsy, there is increased glutamate transmission and decreased GABA transmission. So all the drugs indirectly or directly, they are going to either increase the GABA or inhibitory transmission, or they are going to decrease the glutamate transmission. That's the major rule to follow here. So adverse effects with this drug, so the main ADRs, it is not much used here because it has a strong hepatotoxic potential. So it is a hepatotoxic drug and it can cause aplastic anemia. Vigabatrin inhibits the GABA transaminase, so definitely it is going to enhance the GABA levels, right? That is it's going to do. Then vigabatrin with V is also causing the visual field defect. So need to keep on checking for the vision in this. So vision tests need to be done. Tiagabine is a drug which inhibits the GAT1. What is GAT1? It is a transporter for GABA. So this GABA, which is released into the presynaptic or into the synaptic cleft, it gets taken back with the help of GAT1 into the presynaptic neuron. So if you block this GAT here, there is increase in the level of GABA and it can act on the receptors for a longer period of time. So that is the role here. It inhibits the reuptake of GABA. Okay, that is important here. Then perampanel, another drug which is an AMPA blocker. Again, AMPA is a receptor for glutamate. So they will decrease the action or the effect of glutamate. Glutamate receptor, NMDA is also a glutamate receptor, AMPA is also a glutamate receptor. Then drug is tiripentol, which is a positive allosteric modulator of the GABA A receptor. So it enhances the effect on the GABA A receptor, and this drug is used for Dravet syndrome. It is used for Dravet syndrome. Then the new drug cenobamate, it inhibits the sodium channels and enhances the GABA activity. So when the neurons, the ones which are repetitively firing, it will inhibit the sodium channels there, so the action potential will go down and they will stop firing, and also they are going to enhance the GABA activity. So this is a newer drug for focal seizures. For focal seizures. Major adverse effect with this is hypersensitivity reaction. Hypersensitivity reaction. So called as the DRESS syndrome. And it can also lead to QT shortening. Next, few one-liners here. Anti-epileptic, which is contraindicated in absence seizures. So, which anti-epileptics should not be used in absence seizures? Number one, we have phenytoin, and we have carbamazepine. Anti-epileptic drug contraindicated in porphyria. So, barbiturates are absolutely contraindicated in porphyria. So, phenobarbital. Anti-epileptic causing weight gain, we just now did valproate, is associated with weight gain. Anti-epileptic drug preferred in pregnancy. So, we have two drugs. One is levetiracetam and the other is lamotrigine. So, we first prefer levetiracetam and then lamotrigine. They have a least toxic effects on the fetus. Now, remember, if female patient who's already an epileptic patient, but she is on valproate and she gets pregnant, then what to do? Should you stop valproate? Because what will happen when you stop valproate, there are risk of seizures. And that risk of seizures is more detrimental to the health of the mother. She can die, and we are more concerned about saving the life of mother that time, not the baby. So, that risk is more, so we don't take that risk. What we do, we continue with the dose of the valproate. You will fix it at the best possible dose, and what you do, you will add more folic acid. So, about 4,000 microgram per day you will give. To whom? To pregnant female on valproate. That's the best you can do, because this might help and decrease the incidence or the severity of the spina bifida. On the other hand, there is an epileptic female who is planning to get pregnant. So there you have time. You can first switch or change over to a safer anti-epileptic like levetiracetam, lamotrigine, and when the patient is stabilized, then she can move ahead and go ahead with the pregnancy. That's a different condition. But here, she is already pregnant, and we do not suggest that you stop the drug and change over in between. Okay, so what are the other non-epileptic uses of anti-epileptic drugs? So they are used in neuropathic pain like diabetic neuropathy, etc. Neuropathic pain. So we use pregabalin, right? We use gabapentin. Then in case of obesity, we use topiramate. Other uses of topiramate already discussed with you. It can be used in case of bipolar disorder to decrease the alcohol craving. Okay, so it can be used in these conditions. Migraine prophylaxis. Migraine prophylaxis. Right? Other drugs in bipolar disorder. So, other drugs, anti-epileptics in bipolar disorder. We can also use valproate and we can use carbamazepine. Then in mania, especially the one who are rapid cyclers, more than 4 attacks per year, rapid cyclers, valproate is the best choice there. So these are the non-epileptic uses of anti-epileptic drugs. Now moving on to the drugs of choice or first line drugs in various type of seizures. So the first we have here is generalized tonic-clonic seizure, also called as the grand mal seizures. So we have valproate, we have lamotrigine, and we have phenytoin. Partial or focal seizures, that with its main name is focal seizures here. Drug of choice, we have carbamazepine. Then we can also use lamotrigine. Lamotrigine especially in case of elderly patients, drug of choice. Absence seizures, also called as pet and maul seizures. The hallmark on EEG is 3 Hz spike and wave pattern, and these seizures are because of the special T channels, T-type calcium channels. T-type calcium channels because of the overfiring there. So, any drug which blocks these T-type calcium channels are used in the treatment of absence seizures. So, all the drugs are not used. There are only few drugs which are effective in absence seizures. So, drug of choice remains valproate. Now, in small children lesson 2, we don't give this because of the risk of paratoxicity. So, there we give ethosuximide. Now, another drug we can also give effective is zonisamide. Atonic seizures, myoclonic seizures, juvenile myoclonic seizure, epilepsy, Lennox-Gastaut syndrome, Dravet syndrome. Everywhere the drug of choice here is valproate. That's the important here. Now, infantile spasm or Salam seizures, or called the West syndrome, the drug of choice is ACTH. But if this infantile spasm is with tuberous sclerosis, we use the drug vigabatrin. Febrile seizures in children because of high grade fever, usually these are benign seizures and they become okay on their own. But if not, then what you can give injection diazepam by rectal route. Or we can give midazolam. That is by the intranasal route. Status epilepticus in emergency condition, right, where there is continuous epileptic seizures, the drug of choice is lorazepam by the IV route. If not available, then we move on to diazepam. Simultaneously, we start with fosphenytoin, which is a water-soluble form of phenytoin. Fosphenytoin. So, lorazepam IV, start with fosphenytoin IV. If there is resistance, then you give phenobarbital. If there is still resistance, it is no refractory rather. So, this is a refractory. Then you can shift to the general anesthetics. The GAs you can start off with. For alcohol withdrawal, again IV lorazepam is the drug of choice. So, these are the important points from the anti-epileptic drugs.